And I think we should probably go ahead and get started. This is a very brief learning community conversation, especially for such an important topic. It's really only a 2 hour, now less than 2 hour learning community conversation. Let me say welcome to anybody whom I may be meeting for the first time, and welcome back to a number of people in the learning community whom I've had the great privilege to be in prior learning community conversations with. So welcome and welcome back to everybody. My name is Paul Warren, and I will be facilitating this learning community conversation today. I am currently a research project director at the New York State Psychiatric Institute. I'm also a senior staff trainer and curriculum writer for the Northeast and Caribbean Addiction Technology Transfer Center. And I'm a social worker by training, a graduate of Hunter College School of Social Work. And I'll just say, because it does very directly for me relate to this particular topic of self-care and wellness for all, that prior to my transition into predominantly workforce development through curriculum development, training, and technical assistance, I provided direct services to people living with HIV and AIDS. And I started that work in 1991. And I provided direct service until 2003. And if there's anyone in the learning community who has experience or knows anything about the HIV/AIDS pandemic as it played out in New York City and New York State during the years that I outlined, 91 to 2003, HIV and AIDS were marked with a chronic experience of death and loss. And I can tell you that self-care and wellness became a critical part of my sort of survival strategy in doing that particular work, and is part of the reason why I wanted to develop this particular learning community conversation. I'll also say that a lot of the training and technical assistance work that I do, because I am a senior staff trainer and curriculum writer for the Northeast and Caribbean Addiction Technology Transfer Center, is focused on folks who provide direct care to people with substance use disorders, as well as people with co-occurring disorders, people who may also have a mental health concern or a diagnosed disorder as well. So certainly wellness and self-care are critical to being able to continue to do that important work as well. So very, very happy to have 73 people in the learning community at this particular time, on this particular day, to focus on self-care and wellness. And what I'd like you to consider, if you can, if it's possible, I know that you probably have many things on your plate and many things you're juggling, but what I'd like you to consider is that this 2 hours are talking about this particular topic together is also an opportunity for you to focus on your self-care and wellness, not so much maybe what you might share with your participants, your consumers, or your clients. And that's fine. If there's anything useful that you do want to impart to your participants, your clients, by all means. But what I'm going to ask you to do, and I'm intentionally framing it this way, is for the remainder of our time together, I'm going to ask you to prioritize yourself. And I know for some people, and I saw that smile, I know that for some people that, and Mara Lisa is smiling the entire time, but I think that's a photo. What I want you to keep in mind, folks, is prioritizing yourself. For some people, I'm not saying everybody, but for some people may be a difficult experience. And I invite you to at least entertain that idea for our time together if you're able to. Okay? So having said that, let's take care of a couple of additional logistical elements, and then we will go ahead and go forward. I do need to make one disclosure in regard to this particular topic. And I know you're going to be horrified and shocked by this disclosure. Emphasis on shocked. I don't have anybody other than my own plan for self-care and wellness. So I don't have anything to impart here to anybody that is going to be specifically for necessarily you, because ultimately each one of us are responsible for our own self-care and wellness plan. And, you know, as many times as I've had the great opportunity to be in a learning community with Yvette, it would be absolutely inappropriate for me to attempt to craft a self-care and wellness plan for Yvette, because only Yvette knows what is going to work best. So what I want to assure everybody of, and you may be relieved at this assurance, I'm not going to say we all need to take more bubble baths, because bubble baths don't necessarily do it for me. They may not necessarily do it for you. So wellness and self-care are a unique and individual set of activities, thought processes. Christine, did you want to say something?
No, I just hit unmute accidentally.
All right. But if you're moved to say something, jump right in. Okay.
Thank you. Thank you.
Yeah, of course. Of course. Of course. Always happy to hear from you and anybody else. So feel free to jump in. So, folks, I'm going to share my screen after having shared that shocking revelation, which I'm sure you all knew, but just wanted to underline that. What I will be sharing with you, though, and what we will engage in a little bit, is what I call micro wellness behaviors. And I just share these with you as micro behaviors that you can consider and potentially incorporate if they're of any value or any use to you. And my sense is they're probably things that you already do already. Okay? So just want to underline that. I'm going to share my screen. We'll take care of a couple of logistical details. And you'll notice in this title slide, if you can see this, there are 80 of us in the learning community. If you would be so kind as if you can see the slide and you can see me at the same time, I can't see you, but if you can see me and the slide, just type the letter Y in the chat, just so I can feel rest assured that at least 8 of you, 16 of you who are responding, excellent, good. So people can see the slide and you can see me, good. So self-care and wellness for all. And I just want to keep in mind that you as providers are included in that all. And you may remember I'm asking you to prioritize you during this time that we have together. And, you know, I'll also acknowledge, having said that, that hearing that might make some people uncomfortable, that I'm actually saying, like, you can prioritize yourself. I'm inviting you to prioritize yourself. That may feel awkward or uncomfortable to people in our learning community. And if that's the case, just note it and acknowledge it. Because this is a learning community conversation, because it is intended to be relevant and specific to your experience, your professional growth, your needs, what we talk about may not necessarily reflect the official position of our funders or positions of our funders, and that's perfectly okay. It is meant, we are mandated and funded to create learning community conversations that are relevant and beneficial to you as the important people providing services to people with substance use disorders and possibly co-occurring psychiatric disorders. As the 81 of us engage in this learning community conversation, what I would simply ask is that we keep in mind that how we talk to each other, even in this brief less than 2 hours matters. We do want to be using words and language that are welcoming, respectful, and inclusive of everybody in our learning community. And we want to be putting people first, intentionally first, as we talk together as a learning community. PowerPoint is making it official. I hope I made it official in the beginning. I want to extend a very warm welcome and a warm welcome back to everybody. If you have not yet done so, this will be the last time I'll say it. If you haven't done so yet, please do type your full name and the names of anybody you may be sharing your computer with, who's participating in this learning community conversation. Please type your full name and where you're from in the chat. If you've done it already, thank you so much. There will be a brief evaluation at the conclusion of our time together. And what I would simply ask is, I'm going to try and provide, I'm not always as successful at this, but I'm going to do my best to try and leave a little bit of time at the end so you can complete the evaluation and then go on to your next appointment, hopefully massage appointment or self-care activity. I'm hopeful at the top of the hour. So please complete the evaluation and give us your feedback. And in about 2 weeks, we will send you a copy of these slides that you're free to share and use in any way that supports you. And we'll send you your 2-hour certificate of credit. A couple of other additional guidelines in regard to being intentional about our language and putting people first is you may or may not recall that when you registered for this particular learning community conversation, you actually agreed to have a working camera and a working microphone and to actually be on camera for the first 2 hours, the full 2 hours, first and only 2 hours for this conversation. Having said that, if you need to step away for a moment, by all means, just send me a private message and say, I'll be right back. I'm stepping away. Stepping away means stepping away for a moment or two. It doesn't mean stepping away for 20 or 45 minutes. That's stepping out. We can't give credit for stepping out. And Zoom actually knows when you've stepped out. Zoom is a very reliable reporter. So if you need to step away, feel free to step away. Just let me know, and then just come back in, turn your camera on, and be on camera. Now, I know I see some chats came in. Some people may be letting me know that they're having camera difficulties. I understand that. I know that happens. If that is indeed the case, thank you for letting me know. And just glad you're here, and please participate as best you can without having your camera. Also, there are 83 of us in the learning community presently. That number may go up or down as we go forward. But what I would ask is that everybody remain muted unless you have something you want to add, comment on, question, react to. If you have something that you want to say, if you have information that you want to share, or thought or reaction, don't hesitate to unmute. I do not mind at all being interrupted. You are more than welcome to interrupt me. What I would ask, though, is that if Celeste has the floor and she's making her point, please don't interrupt her or anybody else in the learning community. You can interrupt me, but please don't interrupt anybody else. And I'll do my best to make time for everybody to share what they want to share. Also, we are a learning community. We will all have, there are 84 of us now. We'll have 84 different experiences and perspectives, and maybe even more than 84 different perspectives. So we don't all have to be on the same page. We don't have to all agree. That's what makes a vibrant and supportive learning community. What I would ask, especially if you hear something that you don't particularly agree with, that you listen closely to what's being said, consider it, and if you want to share a different perspective or a different belief or idea, by all means, don't hesitate. You're more than welcome to do that. But we will give each other the respect of letting folks finish their point. And then the last guideline that I would ask everybody to follow is if you'd be willing to please consider speaking from the I. Okay, excellent. All right, so let me just advance the slide and then I'm going to take this down and get your verbal visual agreement that you agree to the guidelines. So can everybody agree to those guidelines as stated? You can wave, nod, throw money, make a deposit in my checking account. Fantastic. Good. Wonderful, wonderful, wonderful. Good. So those are our guidelines. It's okay. You don't need to make a deposit in my checking account. Excellent. All right. So folks, I'm going to share my screen again and we'll just look at the what I think is kind of a robust set of goals and learning activity or learning objectives. But having said that, I'm confident that we'll be able to cover everything that I intended for us to cover today. Again, back to this idea of a disclaimer, I'm acting as a facilitator. This is an opportunity for you to consider, assess, and explore your self-care activities and how self-care activities fit into your life based on your conception and experience of wellness. And you may recall, folks, that I asked you to ponder, and we're going to get to this in a minute, I asked you to ponder what wellness means to you, how you would personally define wellness. So again, I'm just acting as the facilitator here and very grateful to have the opportunity to be with all 86 of us together in this learning community. And again, my hope is that because we are a learning community, that as we talk about this, you will feel supported and feel affirmed about any current things that you are doing to support yourself, to build your own wellness, to maintain your wellness and your self-care. And it's simply an opportunity for you to consider, is there anything that I might want to change, add, or adopt as a way to promote my own personal wellness and well-being. So that's really sort of additional disclaimers in addition to the fact that I don't have your answers as you wouldn't have mine in terms of what might be most, you might find it the most boring thing in the world to take a mechanical clock apart and put it back together. But by way of a personal bit of self-disclosure, I find that very relaxing and mentally absorbing, and it really does promote my personal satisfaction as well as my own mental well-being. Again, the goal is to have a supportive opportunity for us as a learning community to reflect on wellness and self-care. And as I said, a little bit of an opportunity for us to have a little taste of self-care activities together as a learning community of 86 people at this particular moment. So to that end, we're going to talk a little bit about the golden rule, which many people may remember, and then we'll touch on this idea of the stress cycle versus the modern day stress cycle, the idea of and the impact of taking what I have framed as a pause and then the acronym HALT, which many people may be familiar with, and how that relates to the context of self-care. So before, and Nunu, we're going to get to that in just a minute, and thank you for sending that to me. Nunu has put in the chat, it was just sent to me though, but I think it was meant. And Yvette is adding in the chat too what wellness means. Nunu wrote, wellness means to maintain. Oops, they're coming in. But again, I'm going to invite some people to unmute as well. But Nunu wrote in the chat, wellness means to maintain physical and mental health. Yvette writes, spiritual, mental, physical, financial, exercise, and nutrition and rest well. Virginia writes, if you ever watch the PBS program, Doc Martin, you and he share the love of clocks and their mechanics. I should watch that. I certainly do. And a very funny thing, and I'm going to take the screen down for a minute because we're going to talk a little bit about what wellness means to people. Very funny thing. If you know how to drive a stick shift car, raise your hand. Okay, so Virginia does. Suzette, okay. So Darren does. A few people do. Okay, fantastic. Suzette does as well, unless Suzette has a question. Um, no, Suzette knows how to drive the stick. All right. Yes, excellent. Well, let me tell you something, folks. I like a challenge. So I didn't know how to drive a stick, and I thought I'd really like to learn. So I thought the best way for me to learn was to actually to buy a stick shift car and then have to figure out how to drive it out of the place. So I know you're laughing at me. You're thinking, well, that's good for your wellness and self-care and maybe for the other people on the road. But I have to tell you, and you're going to find this a very odd connection, but my ability to take apart and put together clocks helped me to visualize how to use the clutch to change gear. And I actually picked up driving a stick and I bought the car in 2017. I'm still here and there have been no accidents, I'm happy to say. But it's funny how that being something that gives me a lot of pleasure helped me to have a certain strength that I was able to bring to learning how to drive a stick shift. Ah, yes, and I'm not alone. Kayoko also had the same experience. Excellent. Kayoko, do you like clocks as well? Um, Var Vania writes, wellness to be my authentic self and create the safe space I need. Wow. To be my authentic self and to create the safe space that I need. Uh, Rhonda writes, for me, wellness means care of my mind, body, and soul. It's a journey that is positive on my overall health, self-care. Yeah, I do. And fixed typewriters. Amazing. So maybe typewriters will help you learn how to drive a stick too. That's very cool. Um, and Celeste writes, feeling balanced. I'm wondering if anybody is willing to unmute. And Celeste, since you wrote Feeling Balanced, would you be willing to unmute and just elaborate? And then maybe we can go to Alexander if Alexander's willing. But would you be willing to elaborate on what you mean by feeling balanced? And then maybe Alexander, if you're willing, you can pass, of course. You know, this is an invitation learning community. No one's mandated. Um, so yeah, go ahead. Thanks, Celeste. Thank you.
Yeah, I just think about how we have different aspects. We are holistic beings. There's the emotional side of us, the mental, we have our work. We have our times when we're, engaging in things that de-stress us or just kind of feeds us or fuels us, and it's having a balance of all of that. It's not like too much work and now you're burnt out, or it's not engaging in things that you enjoy and then neglecting your responsibilities. So having a balance of all of those things. I think of myself as like a car, and those four wheels represent something. All of those four wheels have to be in place, and none of them, they have to have the right pressure for each one to keep going and function well.
Okay. Thank you. Thank you so much. And thanks for the elaboration. Alexander, invitation. It's up to you. Yeah, thank you. Thanks.
Hear me?
Yeah.
She kind of took my word. I was thinking balance. Just today's a good example. I couldn't, I had to take off for the day just to fill up a lot of trainings throughout the day. And before I started, I decided to work out probably for the first time in like 2 months. So
wow.
So something like that I tend to forget. So trying to find a balance between working all day versus what 10, 15 minutes could mean in a workout.
Mm-hmm.
And I feel better. So hopefully I can actually continue that. So I think it's a balance between overworking myself and then taking care of my self-care, whether it's exercise, eating well. So like today was a good example. I ate lunch, I worked out, and I'm here. So I'm not seeing 10 people or 8 people and not doing any of my self-care stuff. So that's it.
Okay. So today is kind of Alexander Day.
Yes. I didn't think of it that way, but it's a good day to restart some of my self-care stuff when I
Yeah, yeah. And I'm wondering, Alexander, would it be okay if I asked you a quick follow-up question? Because
Sure.
there's something that you said that I personally resonate with, and I'm wondering if other people in the learning community resonate with it too. And because of the specific that you shared, and thank you again for following our guideline, you're talking about yourself, your own experience. So is it okay if I ask you a quick follow-up question?
Sure.
So you acknowledged that today you worked out and you know that working out makes you feel better.
Yes.
And you did also say, if I heard you correctly, and this is the part I identify with, that if I heard you correctly, you said, yeah, this is the first time I've worked out in about 2 months.
Yes.
So I'm curious from your perspective, and I can certainly share from my perspective, but maybe there's somebody else who'd like to talk. But I'm curious from your perspective, if you know that's something that makes you feel better, you know that that's something that works for you. What kept you from engaging in it for 2 months?
It's well, I play men's adult softball on the weekends, and the season ended a month ago, so maybe like a month and a half. So I'm a little burnt out from running around for 5, which again I used to be able to do no problem 10 years ago, but it's not really the same situation. I would say prioritization. I'd rather, in quotes, I'd rather oversleep and then work all day and then come home and then sit on the couch versus the 10 to 20 minutes where actually physically exercise. It's a skewed vision of prioritization. So
Yeah. Thank you. And thanks so much for elaborating on that. And I'll just say, I don't know if anybody else has that experience because I share Alexander's experience. I know the things that make me feel better. And sometimes it takes me a long time to kind of get back to them. And, Alexander, for me too, it's the prioritizing. Like I'll let something else take a higher priority than this thing that I know that makes me feel better. Because I'm kind of tired maybe, and I'd really rather just like sit on the couch and watch something as opposed to like breaking a sweat. Yeah. Other okay, so Parvin writes in all caps, which really got my attention. Parvin writes, self-care means forgiving yourself, being kind to yourself, making time for yourself and your needs, valuing yourself, that you are unique and special, and acknowledge your feelings. Thank you. Thanks so much, Parvin. Rhonda also writes, prioritizing yourself first so you are able to take care of others effectively. And Rhonda, you made me think of every time, of course, I've gotten on an airplane. Like put your mask on first and then help other people to put their masks on. Excellent. And maybe we could hear, Christina, anything you'd add about wellness, like what wellness means to you personally? And I'm only inviting like I invited Alexander. I'm inviting you because I know that you're able to unmute and your microphone works. So if there's something you'd be willing to add for yourself, what wellness means to you.
I think, well, for me, I think it has a lot to do with boundaries for me, like maintaining professional boundaries, maintaining personal boundaries in my relationships, my friendships. I think if I maintain boundaries, that's only going to help support my overall well-being. That way, that's my way of trying to put myself first as often as I can when it comes to my interactions, being in the helping field, helping industry. I think we tend to not always put ourselves first because that's who we are as people. That's why we are counselors or social workers, or so by nature we want to help. So sometimes we could put ourselves on the back burner. So for me, it's really important to keep my boundaries.
Yes, thank you. And I want to link what you're saying about boundaries, Christina, to what Celeste said about balance. And Alexander referred to this too, because boundaries can help maintain that work, personal life, in, the boundaries, like, you know what, 5 o'clock means done with work, and 5:05 means I'm in my own life and I'm not thinking about work. And I love the fact that you also talked about it, how the boundaries are necessary in personal life. It's not just work related, sometimes it's personal life as well. Like we have to set boundaries in personal life as well. Virginia notes in the chat, one thing that I haven't seen noted yet that is important to me is socializing with friends and families as well as all of the above. So those social connections that we have. And Ashley, I 100% agree with boundaries, as I have to leave my old job due to poor boundaries and a toxic work environment. And sometimes that's what people have to do because the environment is not going to change. And Paige writes, yes, love boundaries. I hold myself to only working my contracted hours and take all required breaks. Wow. And Nicole, I think your first name is Nicole. I could be mistaken. And I would love it if your first name was Muskin, but I think that's your last name. Or maybe it's your first name. I don't know.
My first name is Nicole.
Okay.
Yeah.
And your last name is Muskin.
Yes.
Excellent. Excellent.
I just wanted to, contribute that, like, all of this is really helpful and it's so true. I think, being growing up in our society, the emphasis is always on go, 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 money, money, money. And, if you're not that way, somehow you're not valuable, or you're just not valued. And I think that, like, of course, like the other lady said, that we have to be responsible and take care of the things we have to take care of. But I feel like in my life, I've discovered that, I had to find where I had to give myself permission to say, it's okay to sit and stare out your window for an hour if that is what makes you feel joy. And it's okay to, whatever it is that brings you joy and peace. I feel that it's so important, for us as people to give ourselves permission, to recognize, no, I don't need to work 2 more hours and make da 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 da. If when you really begin to examine your heart and what's important and how do you really feel inside, you recognize that peace and that joy is irreplaceable in your life. And I just wanted to say, I hope that everyone is finding the place in themselves where they can give themselves permission to lay back and enjoy their lives, and through meditation or whatever it is it may be, that they're allowed to do that for their own inner peace, and thereby making, it's like a ripple effect into everything else, their friends, relationships. It's a ripple effect. That's all I want to say.
Thank you. And you said a lot, Nicole.
Thank you.
Nicole, after Nicole says that, she says, that's all I wanted to say. So Nicole, there's a phrase, and then maybe we can go to Darren, if you're willing, Darren. Up to you, though. But I want to underline a phrase that Nicole said that I think is very, and I don't mean this in a touchy-feely way. I mean it in, I think, the way you intended it, Nicole, which is the idea that part of wellness and self-care is examining our own heart about what does bring us peace, what does bring us joy, what does bring us fulfillment. And again, Nicole can't answer that for me, and I can't answer that for her. We can only answer that for ourselves. And Nicole, the piece that I really, really, in addition to everything else you said, the piece that I really want to underline for our learning community is the act of self-examination. Because in lieu of that act, we're just kind of like running around. And self-examination does require like making that commitment to yourself. I'm gonna ask myself what it is. Maybe it is that looking out the window for an hour and not having anything else to think of. So Yeah. Darren, the floor is yours. If there's anything you want to add or underline, or if you'd like to share your conception of your idea of wellness and how you relate to wellness for yourself.
Yeah, thanks, Paul. So I just want to say to Nicole, like, thanks for, there was a statement you made at the very beginning of when you started sharing about how we live in a world where we are constantly on the go, on the go, on the go. And it's almost like this society or the people around us, like you said, if we're not doing that, something's wrong with us or whatever. And it was like a gentle reminder for me. It's like almost like I needed to hear that because I am one of those people that part of my wellness is, how can I put it? I approach things from a holistic perspective, I guess you could say, physical, mental, spiritual. And the spiritual aspect of my wellness is a lot of stillness and not getting caught up in, I guess you could say, worldly things, so to speak. And it's so difficult at times. And it's moments like this, sometimes even in a training for work where I hear somebody mention a statement along those lines, and it reminds me, even in my own life, for somebody who, again, I'm self-identifying here, but I practice things like meditation and a lot of spiritual things to kind of keep me grounded and centered. And even somebody like myself who is conscious of these things, maybe even on a daily basis, I still get caught up in the busyness of life. So that was a good reminder. But Paul, to the question, my feedback on all of this is exactly kind of like I stated. I think, there's many different things that many different people can benefit from. But I think approaching it holistically, what are you doing for physical wellness, spiritual wellness, and then of course, mental, emotional wellness. But I think if you kind of tackle it, so to speak, in those three parts, maybe even in some areas you may be really good, like maybe physical wellness comes natural to you, or the mental, emotional doesn't, and maybe that's where you need help. I think that's the case for a lot of people, but I think approaching it from those three different areas can be very helpful. And then, Paul, you said something about like those self-examination skills.
Yeah.
I agree 100%. Super, super important. And then just to add to that, just because I'm a person in long-term recovery and, having others in your life, I think is very, very important. That comes from my like recovery stuff.
Yeah.
But
Virginia
I also think
commented on that too.
Yeah, right. And I think that so having others in your life, who can kind of, hey, you think you might need a break, or, whoever that may be, somebody close to you who cares about you, who we have relationships with.
Right. But
listening to those people in our lives who may be telling us these things, they're not always wrong. I know we like to sometimes think that. But yeah, oh, they don't know, they don't get my life or whatever. But a lot of times they're right. At least I find that. So yeah, that's my feedback. I was supposed to be quick and I ended up ranting. I'm sorry. Thank you though.
Hey, Darren, feel free to rant away.
Appreciate it.
Of course.
That's why I love these trainings.
And there's something you said, Darren, that I want to link to what Alexander started us off with. And then we're going to go to Yvette and we'll go to Marigold. But you used a word, and I'm not surprised that you used this word, but you used a word that I want to add to our conversation. And it links exactly to what Alexander said, and really what other people have said too. You said, Darren, if I heard you correctly, you said, I'm self-disclosing about myself. I practice. And then you said several things. The word that I want to underline, and it's very connected to what Alexander shared and what other people said, is the idea of that wellness and self-care is a practice. And practice means you do something, you engage in reflection, you do something, you engage in reflection. So it's a practice. And I found it really valuable that you put that word on the table, Darren, because it can feel very overwhelming to try and be like, well, what am I supposed to do? And we find our way, and then we can engage in a practice, and an evolving practice, because our needs change. So I really just want to thank you for that word, and very much wanted to link it to what Alexander said, because he gave that such a good example of like, it's Alexander Day. I mean, I coined that, but you can remember, folks, July 22nd is Alexander Day, and devoted to self-care and wellness. Yvette, the floor is yours, and then we're going to go to Marigold.
Yeah. In the beginning of my career, which was very long ago, I was not so involved in where I was working. I was like an adventurer. I was just looking, where do I fit in this world, right?
Right.
So I used to do just enough to get by. I didn't really do too much. I wasn't looking to get a raise or getting a higher position. I was just trying to see, where do I fit in? Time goes on. I get to my career job, right? Which is working with the clients, with the people that we serve. And I was gung-ho in the beginning. I was doing 24/7. I was always involved with what's going on with the client, trying to get them what they needed, doing for them, and I have a family and I have other commitments. And I was like feeling overwhelmed. But not only was I feeling overwhelmed, my co-staffers, they used to pull me to the side and say, listen, cut the bullshit, because you're making us look bad. Because they were just easy peasy. They already got to their plateau. I wasn't there yet.
Yep.
As I started to discover my balance and my commitment to them, but to me as well, I started to say, okay, I'm going to work 9 to 5. Whatever I don't do from 9 to 5, I will leave it for tomorrow, and I will put it on my desk so I hit it right in the morning. When I go home, I don't take the job home anymore. I leave it at work. You know, yes, I have concerns. Yes, you know, I have a heart, right? But there's nothing that I can do at that time. So I do what I can and I move on. And I felt like my self wellness got better. I also used to have, because I was working in the city, they had gym. They had a gym for us. They had yoga. Now I'm not leaving my job till 9 o'clock at night. I'm forgetting that I have a family at home. So the balance has to come from within. Like, you have to figure it out. I had to figure it out. Then I said, okay, now I'm at a place where I'm retired, but I'm still working sort of in the field, because there's always somebody looking for some services that I can probably direct to the right place.
Yeah.
And that's what I do. But I am taking care of myself more now. Like, I have the time, but you can't do overwhelming, because then for me, if I do everyday workout, I will stop after 2 or 3 weeks and I'll take a break of 3 months, right? So I don't do that anymore. I learned what my plate has to look like for me.
Yep.
I work out 2 days a week in Zumba. I do yoga 2 days a week. That's 4 days.
Okay.
And I walk 3 days a week. And that's it. And if I miss something, then I do a little bit of some workout in the basement. And I keep it simple, right? Keep it simple, stupid.
Thank you.
But it's such an easier way to live life, because I was always trying to fix everybody else and I wasn't taking care of me, you know? So that's just my outlook on this. Thank you.
Thank you. Thank you so much. We're going to go to Marigold and then we're going to come back to Nicole.
Okay. Hello everyone. So well, Marigold, just to pick up piggyback from what Dennis said, Darren said, like, I think last year I went through a lot of series of traumatic events within like 2 months, and I had psychosis and even survived 2 suicide attempts, and my episodes were pretty bad. And I think part of what got me out of that dark timeline is my spirituality. And the trauma, I think, caused something called spiritual awakening. And so I did a lot of spiritual practices. Not like I was raised in a Christian home, but I literally did a lot of research, and I was able to identify so many spiritual practices from Eastern Asian belief system and even Native American system with my Christian practices as well, and I mingled it. And like now, out of all the things I went through, and so like self-care has been really huge in my recovery. Like whenever, part of it is being aware of how I'm feeling. So whenever I get overwhelmed, I tend to cry a lot. So I know that when I get overwhelmed, I begin to like shed tears. So that's a sign. So I quickly do my meditations and try to be mindful of like situation that causes anxiety or overwhelm, like gets me overwhelmed with emotions. And so that's what I've been doing. And it's hard to be a perfectionist and to like practice self-care, because part of, you know, the idea that there's something wrong, you being a perfectionist, you want to be perfect all the time. So being aware of that has really been helpful to me. Yeah.
Thank you so much, Marigold. And you know, I think you're touching on two really, really critical components to think about in terms of self-care and wellness. And again, thank you for sharing from your very personal experience, as others are doing as well, that there are certain signs that will communicate to us that we need to maybe practice some self-care and some wellness. And Marigold gave such a great example of that. You know, sometimes for some people, shedding tears is an indication that maybe there's something I need to do. And the thing that, you know, we can all consider as part of our own experience of self-care and wellness is, what are our indicators of the need to take an action? And I love that Marigold gave such a specific example of that when she finds herself overwhelmed by emotion and the tears come, she engages in her spiritual practice, which for her might be meditation or prayer or a combination of those things. And that's a way of being proactive instead of allowing things to accumulate. Because I will throw out for all of us to consider, and Marigold, I really, again, thank you for sharing your personal story, is that accumulation unaddressed, there can be significant and serious consequences to neglecting our own self-care and wellness, and consequences that go far beyond being less effective with our clients. So that's a very powerful gift that Marigold has just shared with us. The other thing, Marigold, that I really want to underline, because I think it's at the heart, and Yvette alluded to this when she was sharing, is that self-care and wellness is not about perfection. It's not about driving yourself to perfection, because we become aware of something and then hopefully we take an action. And sometimes we do that right away. Sometimes maybe we wait a little longer than we should. The takeaway, though, is please don't ignore your own cues, which could be physical, emotional, and spiritual. Please don't ignore those cues and engage in whatever practices work for you. Nicole, the floor is yours.
Thank you for having me again. I'm going to keep it short. I had forgotten to mention that, you know, like Marigold had said, the perfection thing is like so toxic, and it's just not helpful at all. And I remember hearing I was watching something, and this lady was like, it's not all or nothing, it's all or something. Because when you look at like, oh, I'm going to clean my house today, Okay, well, I'm not going to get, I may not get all 5 rooms done, but if I get 2 rooms done or even 1 room done, then I still say, good job, Nicole. Like, I encourage myself for every step I take in the right direction. So that's another toxic thing from our society. I feel like if you don't get it done, if you're not 100%, then you've lost. No, that's a lie. And then the other thing I wanted to say, so remember, not all or nothing, it's all or something. If I do 10% of what I'm supposed to, that's great. Be encouraged, encourage yourself for everything good that you do, encourage yourself. And then I wanted to say, the thing I forgot to mention real quick is that, our inner child is so important in our life. So if you remember back when you were a kid, even like 4, 5, 6, even young, the joys that you have, children by nature in general, I mean, except for when they've been in terrible situations, but in general, children, they have a lot of freedom and joy, just that's within them. It's just born that way. And so we all still have our inner child. The inner child does not go away once we become 50, 60. That inner child's always there. And the inner child is to be in touch with your inner child, to be in touch with, I always say my inner child is my heart. My mind is my adult. This is how I do it. And my inner child is my heart. And so my vulnerabilities are in my inner child. My freedom, all these things are in my inner child. So just to be connected to, seek out your inner child and just, don't forget the inner child, your inner child. That's all I'm going to say.
Thank you. Thanks so much, Nicole. And before we go to Rosalind, I'm going to ask, Nicole really prompts me to want to just do a quick poll before we go forward. And, we're a learning community of 85 people. It's voluntary. But what I'm going to ask everybody to do, just for just a moment, and Nicole, you inspire me to want to ask this question, because this is everybody's going to answer this question very uniquely. But what I'm going to ask everybody to reflect on for just a moment, and I'm just asking you to use this, we have about an hour of remaining time left together. But and this won't take an hour, trust me. But what I'm gonna ask you to focus on for just a minute is something that brings you great joy or a lot of pleasure. Is there something that comes to mind for you that brings you great joy or a lot of pleasure? And just picture that thing in your mind. And if you feel comfortable, just type it in the chat. Okay? I'm gonna type one in, partly because it's related to something I'm gonna do later tonight. But again, I see that people are typing things in. My grandchildren, going for walks in nature, creating collages, doing anything artistic, crocheting and gifting the blankets to my loved ones, breathing. I love breathing. I'm a big fan of breathing, especially at this particular moment. Coffee, yes, love that too. And by the way, well, before we get to Rosalind, I'll just say, that I bought a car that I couldn't drive to learn how to drive it. I didn't start drinking coffee until I was 55, and I really like it. So I'm not giving it up at this moment. Okay, so I'm just going to type one in, and then Rosalind, I'm going to hand you the floor, okay? Okay, so there's something that gives me, I like going to auctions, and I'm going to an auction tonight. I find them exciting. Anyway, Rosalind, the floor is yours. Thank you for your patience.
Okay, I just want to say that well-being is taking care of your mental, physical, emotional, social, all of that. And in doing this mental health work, from time to time, I know in my work, I have to do diagnostic assessments, and listening to the trauma, the past trauma of consumers, that can be a difficult situation. So doing more than one a day, it can be difficult. So after doing those particular things, relaxing, cooling out, watching TV, you know, playing a sport helps out a lot. Because if you don't take care of yourself, you're no good for your consumer. You can't help them. And taking care of self is all of that. Making sure you have your physicals yearly, all of that. Taking, if you have medication, consistently taking your medication, that's well-being. Taking care of all of that so you can assist the consumer, help a consumer out, because we do this dynamic work and it's difficult. So those kind of things helps out. That's pretty much it.
Thank you. Thanks so much. Angela, the floor is yours.
Hello, everyone. It's Angelia.
Angelia, thank you. Thank you.
I just want to echo what Rosalind said, because I tell my clients that all the time, and my family as well. You have to take care of yourself before you can take care of anyone else. Because the way you show up for them, you know, is gonna be impactful. And so if you're not well, then you can't be there, you know, for them the way that you would like to be, or, you know, they need you to be. But the other thing too is taking care of myself, you know, just listening to what Rosalind was saying and everyone else. My husband and I take vacations every 3 to 4 months, because we are I'm in this helping profession, and I'm also a licensed clinical social worker. And however, you know, secondary trauma gets into your spirit, you know, and I already have anxiety, you know, and so I have to take care of myself. And I do this thing where I detach. I don't have our phones on, you know, because we go on a cruise, you know, that's what I like to do. One, because I don't have to clean up after anyone, especially my husband, you know, and I don't want to take care and cook and do none of that. I just want to relax, you know, and that's my time to read a book or catch up on some things that I wanted to do. And so also showing up, and that means not always being on. So I don't want to be on all the time. And that's my time to not be on. I don't have my phone on when we go on the cruise. My husband and I, we're texting each other like, where you at or what have you. Other than that, we're not connecting with family back home, because that's our time, our quality time, and then just our time to get away. So that's all I want to say.
Yeah, thank you. Thanks so much for adding that. And I want to link, Angelia, what you said and what Rosalind said, because it took me a while. I'm a social worker as well, and it took me a while to believe and accept that just hearing people's stories could have an impact on me. And it does. And Angelia referred to it, this idea of secondary or vicarious trauma, the fact that we are in the same space, bearing witness, hearing what people are saying, it has an impact on us. So I can't thank Rosalind and Angelia for echoing that and for putting that on the table. And I also just want to say, Angelia, the other thing that I love about you describing your experience on the cruise with your husband is talk about setting and maintaining boundaries, because it's like, this time is for us. And we're going to be very clear about how we interact with anything that's not us. And that's all about boundaries. That's protecting what you need for your wellness. I hope you're okay with me framing it that way, Angelia. Protecting what you need for your wellness. Okay. All right. I presume if you didn't like that, you would let me know.
No, you're totally fine. I was shaking my head. Yes. You're totally fine.
Okay. Just want to make sure. All right. So folks, I'm going to share my screen again. And we're just going to talk through a couple of things, and then we'll start to bring our conversation to a conclusion with just a couple of little opportunities for some micro practice together as a learning community. Because remember, I did invite you to consider that this time together is Alexander Day. This is your time for you and for Alexander. Yvette, you like that? Excellent. Hopefully Alexander does too. Okay, it gave me a thumbs up. I guess it's okay. All right, so let me share my screen again. And, the reason that I wanted to go back to the golden rule was this idea that, it's do unto others as you would have them do unto you. Hopefully I got that quote right. But the idea that, we want to be interacting with our patients, our participants, our clients, and with people in general in a way that we would hope to be interacted with. And I think the reality is, folks, that's not always what we get back. And that's partly the nature of the work. And the reason that I wanted to underline that is that sometimes we have expectations of our coworkers or patients or clients that, maybe they'll say good morning, or maybe they'll show respect, or maybe they'll behave like an adult, or maybe they'll do what we tell them to do, or maybe that they'll say thank you. And we may have 10 million other expectations. But the thing I want to throw out is that our wellness, our well-being is not dependent upon other people's lack of respect, whatever. And if we think about our patients and our clients, they may not, given their experience, have the capacity to meet any of these expectations. And don't misunderstand me. I'm not saying that we should accept abuse from patients or clients or participants at all. What I am saying is that if we start to find ourselves stung, upset, agitated by the fact that, we're not getting the same respect we're offering, that may be an indication I need to think about my wellness and my self-care, because folks aren't always possible to meet. The people we're providing services to may not always be able to meet those expectations. So that can be another indicator of that, maybe I have a boundary that I need to set, or maybe I have a need that needs to be met. Virginia writes, a friend in recovery taught me that expectations are often predetermined resentment. Yeah, because it could be easy. And again, how successful can we be providing care if we feel a resentment toward the person who's seeking care? So it's incumbent upon us to manage all of those things so that we can be in a place to do the best possible job that we can at any given moment. I'm going to share my screen again. And again, the problem with expectations is that, maybe the expectations are unrealistic. Maybe the person is behaving that way because their favorite pair of pants didn't get washed and they couldn't wear them. There could be a million different reasons. Their day started with an argument at home. They didn't sleep well. They skipped breakfast. They didn't have access to food. They slept on the street. They lost their medications at the shelter. Unmet mental health needs. No money to take the train. There could be a billion different reasons, folks, why somebody may not meet our. Did somebody want to say something? Go ahead. No? Okay. All right. If there's something you want to say, go ahead, feel free. So just keeping that in mind, folks, that can be an indicator of that we need to be focusing on what we need to do for ourselves. We may also say, hey, I didn't sign up for this. This isn't my job. I'm not trained or paid to do this, because sometimes people come into the moment with things that are way outside the scope of what we can do. And we may not be able to provide them with what they need at that particular moment. And what I'd like you to consider is, although we may not be able to provide them with what they may need exactly in that moment, or we may need to make a referral, how we do that, the way we approach communicating that we may not be able to give them what they want, is going to be very strongly connected to how balanced or centered we are in ourselves at that particular moment. And yeah, we may feel bad that we can't give them exactly what they want at any particular point. Courtney writes, I just want to share something my agency has done. We have a wellness committee. We talk about ways to help staff with their mental health. We set up sensory boxes around the office for people to use bubbles, Play-Doh, coloring. Just an idea for you guys and your agencies if you are open to it. And Tori says that their agency has a wellness room. Tori, I don't know if you're able to unmute, but would you be willing to say anything about the mysteries of the wellness room? I'm not sure exactly what could happen in there. Maybe there's coffee and free clocks to repair. I don't know. But that might be in my wellness room. But Tori, what's in yours?
In our wellness room, we have a couch to lay on, some fuzzy blankets to cuddle up with. I don't know what they're called, but like the things where you can play in sand and draw different designs.
Okay.
Zen gardens, that's what they're called.
Okay, yeah.
And then we have, I don't know what they actually are. To me, they're sensory toys that you can like rub on you and feel like the bumps on them.
Yep, yep.
But other than that, it's really just a room where you can come and scream and yell and do whatever you want.
Okay. Okay. It's funny, you know, I used to work for a program that provided care to children who a sibling or a parent had died. And it was a group program, and we had, I guess it was kind of their version of a wellness room. It was called the volcano room.
I like that.
Yeah, it was great. And they could yell, they could play really hard. There was a punching bag that they could hit. And again, folks, some people, these things may work, you know, fuzzy blankets may work really well for some people laying on the couch. And for other people, that may not work. They may need to, you know, get out of the building and go for a walk, or they may need to speak to a trusted colleague. If Travis was my trusted colleague at work, maybe I would, you know, ask if I could talk to Travis briefly. So it's whatever works for that unique individual. And again, thanks for sharing these ideas that some organizations are trying to be responsive to the fact they're creating a space. And in addition to creating a space, what they're doing is they're saying, we're dedicating resources to protect and support the wellness of our providers, of our staff. And that's a lot in and of itself. Even if I just went into the wellness room to sit quietly for 10 minutes.
Yeah, it's really nice to have a space where if you're having a hard day, you can just come in and do your work silently, and they know that if you're in the wellness room, that's your time to be by yourself.
Yes. Yep. Fantastic. Yeah, it's kind of like a physical boundary. Like, this means do not disturb.
Yes.
If I'm in the wellness room. Yes. Excellent. I'm going to share my screen again. All right. So I want to share this idea with you folks. I'm not sure how many people are familiar with this book, Burnout, The Secret to Unlocking the Stress Cycle. If you're familiar with the book, type an F in the chat. If you're unfamiliar, and Rhonda says in the chat, I put mental health messages in the main meeting room. I also give out sensory stickers to the staff. So every month the notices and tips are updated. I walk with other employees at lunch and in the evening before. Okay, not familiar. So many people are not familiar with this book. I'm sharing this book, the idea of this book, as a resource with you. Again, for some people, books are very helpful. The thing that I found particularly useful about this book, a colleague of mine, Dina Vandersloot, shared this book with me, an extraordinary colleague who is an expert in the evidence-based practice of motivational interviewing. She shared this book with me. And the thing that I found really helpful about this book was this whole focus that these two sisters, Emily and Amelia, have, which is that as human beings, we have something called a stress cycle. And the stress cycle is something very normal because obviously stress in a variety of forms has been around ever since human beings have been around, and probably ever since life, even before human beings, has been around. But they're really addressing this idea that there's a link between an uncompleted stress cycle and burnout. And I alluded to this earlier, as did two of our colleagues in the learning community, this idea of cumulative or unexpressed, unresolved stress, anxiety that can be just naturally part of the landscape of work. So I wanted to share this conception of the stress cycle and then the modern day stress cycle with you, just as a way of thinking about the rationale for engaging in the practices that work best for us to promote our self-care, because they are the antidote and they are what can help complete the stress cycle, help us to manage the stress, which is often just part of the landscape of the work. So they suggest that, and again, this is the stress cycle completed, and they're linking us with kind of a primal stressor, let's say, of that. Let's say we lived somewhere where lions roamed free, and we come across a lion, and we would have an emotional, physical reaction to that particular lion. And so the lion is the stressor. We're exposed to the stressor. We have a particular reaction to the stressor, and then we take the physical action of running away from the stressor. Physically, we're running away. And through that running away, we escape. We get back to a place of safety. So we experience the stressor, we had our reaction to the stressor, and clearly this is a flight response. We flee and we get to safety, and we're like, whew, made it to safety. And now I can tell everybody about what happened, and I can share the experience with them, and then I can go on with my life. So what they're suggesting, and I'm going to take the screen down for a minute, is what they're suggesting is this is a completed stress cycle. We're exposed to the stressor. We have a reaction to the stressor. There's physical activity somehow managed, folded in there. And then we get to safety and we express what happened in a safe place. That's the completed. That's where the stress is expressed and then integrated, and we move forward. Okay? That's what they're suggesting is a completed stress cycle. Now they're also suggesting, and I'm going to share my screen again, there's something called the modern day stress cycle. Yeah, Celeste, I see your wheels turning in regard to that. The modern day stress cycle. And before I show you the image, what I will throw out for you to consider is that what the modern day stress cycle they're proposing, the impact that it has, it creates, and I'm going to use a very evocative word, it creates a stress clog where the cycle is not completed, so the stress that's there gets clogged, and then the next stress that happens is also clogged and stuck. And it's this continual backup or clog that can lead to burnout. So let me just show you the visualization of that they have. And then I'm just going to ask for your thoughts or your reactions to that. What you make of it or what you think about this idea of the impact of the modern day stress cycle. So again, they suggest that there's a stressor. And in this instance, they're saying that the stressor, the modern day stressor has been, let's say, substituted by an unhappy supervisor, okay? Could be anything, but just for the purposes of a visual, they're saying an unhappy supervisor. So the stress is encountered, we have a reaction to it, and then in our reaction, we might think, okay, well, I'd love to run away from this, but because we're at work, or I'd like to fight this, but because we're at work, or maybe I will just freeze and shut down, but because we're at work, or maybe I'll just fawn my way through it. I'll just yes the person to death to get through it. But what they're suggesting is those primal management impulses, fight, flight, fawn, or freeze, don't work within the modern world, and they get blocked. So therefore, the person doesn't get to a place of safety because there's a clog that has occurred and they are in a loop. They don't get to a place of safety. They don't get to tell the story. They don't necessarily get to integrate it or work it through or get it out of their life. And ultimately, what they're suggesting is that we get stuck in this cycle because there are chronic stressors, because of social appropriateness or inappropriateness. We could lose our jobs if we challenge our boss to a duel or we're going to fight. So we don't do that. And sometimes it's safer in situations. So then they're suggesting what happens is we get underwater in regard to it, which can lead to burnout. So let me just pause here and ask, any thoughts, any reactions? And Kelly DeVito, I don't know if you have any thought, any reaction, but any thought, if you'd be willing to share, any thought or any reaction to this idea of the clog with the modern situation? Any thought, any reaction to that? Would you throw that idea completely out the window? Does it resonate? Any thought, any reaction?
Yeah, I think that is actually what does happen in our society to a lot of people. So to hear it be said that way, I think a lot of people can relate, unfortunately, to that, where there is nowhere to escape and go. And I think that's why there are so many people who are struggling, is because of that, because there's no, you can't leave the situation. Yeah. So having these, having wellness is so important, because you can't escape from that at work unless you have a job that really truly is 100% into wellness itself. I mean, they can tell you to take a webinar and not actually mean it. But right. If you work for a company or an agency that is truly invested in its workers, knowing that information can help so that you can all work together to not get there.
Yeah. And you're interesting. You're sharing an interesting point, Kelly, because you can also, if you're all kind of on the same page of that, this is the thing we're trying to prevent, then you can more kind of collaboratively or collectively choose an approach to manage it. And you brought me back to something that a company that I used to work for, what they originally did, and then because of pressures of productivity, they yanked this program. But what it was, when I worked in HIV early on, it was mandated that every staff person had to go to a staff wellness group once a week. And you were like assigned to a group with coworkers that weren't in your unit, and everybody got together, and it was the conversation facilitated by a counselor, where we all got to talk about the stress of our work and how we were coping with that and what our experience was. And I was in that group for, I think, about 6 years. And then the company said, you know, we really just can't afford to do this anymore.
Put you together in front of those who broke you.
So they basically pulled the plug on it. And it was a huge problem because it was a great safety net for everybody. But again, they chose a different strategy after having one in place for many, many years. Varnier writes, we have established work from home day once a week, helping with the workload and the work-life balance. Fantastic. And that can be a great strategy as well. I will also throw out, it can also be problematic. I work from home much more than I have to go into the office now. And I have had to work personally on my boundaries because there are times when I begin work at 6:30 in the morning and I'm continuing to work after 5 p.m. And I'm not complaining about that. I'm just saying that I've had to watch my boundaries in regard to that because I could continue to keep working. Go ahead, Celeste, the floor is yours.
I meant to raise my hand, but you deserve an applause as well.
Thank you.
No, I was gonna say that working from home used to be something like a privilege that you had to earn, but then during COVID, you know, my job completely switched to, you know, working at home from home completely. But it is harder to establish that boundary because think about it, when you're at the office, you go through that process of shutting down your computer, locking everything up, going to the parking lot, the physical act of driving. Mentally, there's like a stop.
Yep.
The locations change, right? So like it
Yep.
helps you to shift.
Yeah.
I work from home and it's like, all right, I close my computer and now it's like on to the next. It's like there's no break. It doesn't help to establish those mental boundaries, you
Yes.
know.
In fact, it blurs them. Is that, or would you accept that, Celeste? That it blurs them?
Oh yeah, absolutely. Mm-hmm.
Okay. Because that's definitely been my experience. And sometimes I have to leave what I'm working on in the room where my computer is and go into a different room. But it's not the same thing as, you know, for me, it was walking out of the building and getting on the subway and taking the train home. That was very helpful in boundary setting at times. Yeah, thank you. All right, so folks, what I'm going to share with you now, and none of this is going to be new, none of it's going to be a surprise, is that there is actually research data that shows that a number of these activities, all of which you've already all mentioned, but these particular activities, if we choose to engage in some of these activities, and I'm thinking of Alexander as I say this, because the first one that I'm going to show you is some sort of physical activity. And to me, that's no surprise when I think about this stress cycle model, that engaging in some sort of physical activity, sometimes that's a walk around the block, sometimes that's working out, sometimes it's, you know, punching a punching bag, whatever it may be for you, but some kind of physical activity. So I'm just going to quickly review these activities that research has shown us can help to manage the stress. None of these are new. Many of these are things that you engage in already or engage in every 2 months, depending on whatever your schedule may be. So it's just a way of re-establishing or exposing you to them again. I'm going to share my screen. So moving away from being underwater, the idea that these are some of the things that can actually help complete that stress cycle. First and foremost, physical activity of many different kinds. This has been referred to already, and I think it was Virginia who first put this on the table. But the idea, and other people talked about, having expressly time with just their partner or just their family, their husband, their wife, their significant other, connections and positive social interactions outside of the work setting. Laughter. I love this picture because I don't know what this family is talking about, or this family of models. I don't know if they're models or if they're real family, but whatever they were talking about, they all really look to me like they're laughing. And I don't know about you, and somebody mentioned this earlier, I don't know if it was in the chat, but somebody mentioned how laughter can be really helpful. I just find for myself, there are certain people in my life that really make me laugh. And when I am in their company, I just feel so much lighter. So I love this picture because to me, it really is expressing people sharing laughter together. And even if they're models, they're good actors. This idea, and it was talked about, sleep, meditation, and rest. Oh, Rhonda says, check out laughing yoga. I would probably really like that because I like yoga too. So sleep, meditation, rest. And again, that's very unique to every person. It's funny, this past weekend, I was just at a birthday celebration where there was lots of laughter. And I got into a conversation actually with the person who owned the restaurant in Manhattan. And she was telling me about a monastery that she goes to where she practices meditation. And she was saying how that, like, when she had gone to other places, she really felt like she just couldn't get meditation. But when she found this particular place, it was just the right fit for her. And she found her way into meditation. Not all these, not everything works for everybody. We find our own unique way into the things that actually work for us. And Margaret says, yes, laughter is good. I agree, Margaret. I agree. I agree 100%. It's certainly good for me. Also, creative expression is really good for me too. In fact, and a number of people mentioned in the chat that anything creative is really good for them. I do also know people who have told me, I don't share this experience, but they have told me that sometimes when they're in situations where they're invited to be creative or where they're handed crayons or paint or paper, they feel anxiety. And again, I don't personally relate to that. I can certainly empathize with how that may not work for everybody. I'll be honest, and I'm making an I statement here, that creative expression has been a part of my stress management strategy probably ever since I could pick up a crayon. And that was pretty young. So creative expression is a strong go-to for me. Yeah, thank you for sharing that, Nunu. And again, I really appreciate the idea that meditation is a practice, and you get to decide how long you're going to meditate. And as long as you're engaging in the practice, I have a friend who I meditate with sometimes, and he meditates for 60 minutes at a time. And at first, that was really difficult for me. And the more I practiced it with him, the more comfortable and able I was to meditate that long. And by all means, let me underline, not perfectly. It's a moment at a time for me with meditation. Also affection, and that affection is not limited to just affection with fellow human beings. It can also be affection that you have with a loved creature that you either share a space with or know or spend time with. I'm very fortunate and blessed to have a dog. This is the first time I've ever had a dog. And I have to honestly say, and I have had a cat before and I love cats, that having a dog is like a revelation. I never realized how strongly I could feel for a little creature who was, in my care. And I can only imagine, and I'm not in any way comparing children to pets or animals, but I can only imagine what it must be like for parents who have children. I don't have any children, but what the love and the affection you feel toward and from children must be extraordinary. And I mean, I certainly feel that to some degree with my nephews and nieces. Yeah, and hugs are great. That's very true. Oh, I just saw something about puppies. What was that? Our dog had 7 puppies, and feeding them is so fulfilling. Thank you, Marigold. Thanks for sharing that. And so for some people, and Marigold, you talked about tears and crying being an indicator that it's time to engage in some sort of practice. For some people, actually releasing tears, expressing their tears, having their tears, is just a wonderful way to help let go of the stress, the pain, or the emotion, or the joy, because tears can be associated with all kinds of emotions. But allowing oneself to express the tears can in of itself be a way to release or manage stress. Rhonda writes, I love my veggie garden. It relaxes me and I get happy seeing the bees pollinate and then the growth of the vegetables, while others say it causes them to feel stressed because it can be too much work in trying to keep bugs and animals away. Yes, absolutely. And I have to say I'm caught between both of those. I don't grow vegetables, but I do try and grow plants. And sometimes I have to just let it go that the rabbits have eaten what I've planted. I like rabbits too. Rabbits too, not rabbit stew. I don't eat rabbits. And this is really the thing I'd like you to underline and walk away with, is this idea that wellness is not a state of being, but a state of action. That wellness is unique, it's specific to each one of us. And yes, it can create a state of being that can be achieved through actions or practice or activities. And again, it's also a theme from the burnout book, Unlocking the Stress Cycle, that if we reflect on, engage in, intentionally consider, and then go forward with actions, we can actually promote our wellness and manage it. So to that end, I'm just about every learning community conversation that I ever have, I figure out a way to incorporate this photograph as a way of supporting my own wellness. I took this photograph, and if you know what it's a picture of, type it into the chat. Or if you want to guess what it's a picture of, type it into the chat. And then I'll see if anybody wants to, and if you know already, feel free to type it into the chat. Yes, it is the Grand Canyon. And to put a very fine point on it, it is the south rim of the Grand Canyon. And I have been both to the south and the north rim of the Grand Canyon. And I have been there at last count 11 times. I would love to be telling you the next time I see you that I've been there my 12th time. But I mention this to you because I want to underline how self-care is so unique to each one of us. Some people may think of the Grand Canyon and think like, I would never go there. And that is because that would just not be a place that they would find healing, interesting, and that would not be the place that they would go. This is also a picture of my dog. And if you know what breed of dog this is, feel free to type it. I agree, Virginia, it is a pretty remarkable place. And I do find it a very spiritual place as well. But I'm showing this to show you how idiosyncratic. Courtney says a Jack Russell. That's a good guess, Courtney. A Ghanaian dog. Yes, Marigold. And that is they are referred to as Ghanaian dogs sometimes. They also are referred to as village dogs, and the breed is called the Basenji. And if you've ever heard of a Basenji before, type an F for familiar if the chat in the chat. If it's new to you, type an N, and I will accept Ghanaian dog because that's another name of them, Marigold. Very, very well observed. It is not he's not a German Shepherd. Although that was a dog that we considered as well. Yes. And the last image I'll show you, because this is self-care for me, of course, is a clock. Now, this is not a clock that I have the expertise or the skill to take apart, but I certainly am very appreciative that it is part of my clock collection, and I've taken it to an expert, and I enjoy it. Oh, okay. So Brittany has a Jack Russell Terrier, and she is Brittany's whole life. Brittany, if you don't mind my asking, what is your Jack Russell Terrier's name? My dog's name is Imhotep, and we call him Emo for short, IMO. Brittany says her dog's name, oh, an owl clock. Yes. Brittany hasn't told us the name of her dog yet, and she may not tell us. That will be up to her. So wellness and you, because you would maybe show 3 Arwen. Oh, like from the Lord of the Rings, the elf. Yes, is did I get that right? Am I pronouncing it right? Arwen from the Lord of the Rings movies. J.R.R. Tolkien. So self-care and wellness is unique to every one of us. And what I'm going to ask, yep, got it, that is her name. Yes, she is the elf princess. Yeah, and she's very cool in all the movies. I love the Liv Tyler. I believe that's the actress who plays her. I wish they would do a movie that's just about the elves because they're all very cool. So there's an activity that I'm going to ask us to engage in, which I call a taking a pause activity. So what I'm going to ask all of us to do, if we can, oh yeah, okay. Yeah, a lot of crafting and journaling for self-help, absolutely. Is I'm going to ask us, and again, we've had a little less than almost an hour and 45 minutes together. And what I'm going to ask, if you're able to do it, is to put everything out of your hands and to just allow your attention to focus on your breath for a moment. And this will really only take a couple of moments. So if you cannot be distracted by anything else for just a couple of moments, and that may or may not be possible. And I respect whether it is or isn't possible for you. But if it is possible for you, let's all try and just take a pause together. And what that simply means is we are going to take 3 breaths together, but we're going to breathe in a very intentional way. And some of you may be very familiar with this. And I'm going to describe it to you first, and then you're going to do it on your own because we all breathe differently. Okay? I don't want to force you to breathe like I breathe. So what I'm going to ask you to do is I'm going to ask you to take a breath in and then just pause briefly and then let the breath out and then pause briefly and then take your next breath in. Okay, I'm going to demonstrate it once and then we're each going to do it in our own time for 3 breaths. But let me demonstrate it first. So I'm breathing in. I paused, I'm breathing out. I'm pausing. And then I'm breathing in again. Okay? Now I'm going to invite all of us in our own time to do that 3 times and then type the letter Y in the chat. And then I'm going to ask you a question. So just 3 breaths with the pause, hold, and then pause. And once you've done that, just type the letter Y in the chat. And what I'm going to ask everybody to do is just take a moment and use one word to describe how you feel right now. One word to describe how you feel right now. Relaxed, relaxed, light, present, calmer, lighter, splendid, relaxed, easy, calmer, peachy, light. I love these words. Alleviated, calm, relaxed with 2 X's, more peaceful, be present, sleepy, calm. So just keeping that in mind, folks, we took that pause for only 3 breaths together in a Zoom meeting, okay? And it can have that kind of impact, just 3 breaths. And what I would throw out for you to consider, and I'm going to share my screen again, is that you can take a pause, you can choose to pause, and take a pause and start your day, start your moment over at any time you choose. And again, I'm throwing this out as a micro activity, a little thing that if you choose to practice it, you can do this for yourself at any moment you decide you want to take a pause and start again. The other thing that I'm going to invite you to consider is that you can also engage in a mini activity, which is focusing your attention, where you focus your attention on your body, what you're feeling physically, and you can go from the bottoms of your feet to the top of your head, where you can focus on your thoughts, and where you can focus on your emotions. It's a way of doing a quick mind, body, emotions inventory. And if you're feeling stress in any of those areas, if you're feeling overwhelmed by any of those areas, you can simply breathe into them and let them go. You can also ask yourself, am I hungry? Am I angry? Am I lonely? Or am I tired? And if you answer yes to any of these questions, if you're able to, in the moment, and you may not be able to, but if you are able to, maybe you can get yourself something to eat. Maybe you can talk to somebody or engage in some physical activity to let go of the anger. Maybe you can connect with or think about somebody that helps you to feel less lonely. Or maybe you can get one of those fuzzy blankets from the stress management room and curl up on the couch for 10 minutes. Again, if you're able to meet the need, and if you're not able to meet the need, you can acknowledge that you have the need and you'll meet it when you can. So again, another way to do a quick inventory about your needs, and halt, of course, can also mean stop, and if you're able to meet the need. Yes. So Brittany writes, reset, recharged, ready to start again. From 3 intentional breaths. So never forget, folks, that self-care, of course, is the key, and probably the key to balanced living and effective service provision. That first and foremost, we need to acknowledge that the work we do, as our colleagues made very clear to us, has an impact, and that we can focus on and become acquainted with how stress shows up in our bodies. And Marigold gave us that great example of when feeling overwhelmed or anxious or strong emotions, sometimes the tears come. But knowing ourselves, examining our own hearts, minds, and spirits, and knowing how stress impacts us and impacts our reactions to others. And we can remind ourselves we're in a learning community of 83 people currently, reminding ourselves that we're not doing this work alone. And if it's possible, can we talk it through with some other person, or maybe more than one other person? Maybe we're fortunate to have a supportive group supervision where we can talk through things. And if it's possible, and our colleague gave us the great example of taking a cruise with her husband, if you're able to take time away when and if you can, and setting boundaries around protecting that time away. And if your organization has resources, rooms, programs, I don't know about you, my organization, I get paid vacation time. And I'm making an I statement here. 1 year, I lost 350 hours of paid vacation time because the company basically says, use it or lose it, and we're not going to pay out on unused vacation time. I learned very clearly from that example of my company wants me to take my earned vacation time, that they're willing to pay me to take a vacation. So you can ask yourself, maybe my company has these programs. Am I taking advantage of them? And how can I help myself to take advantage of them? Brittany, thank you so much for sharing that picture. Very sweet. And you said Jack Russell, I believe, yes. And then one of our colleagues mentioned the idea of pursuing outside work, relationships, connections, activities, and fulfillment. If our work becomes our whole life, our tires may be unevenly inflated on ourselves as the vehicle. Agreed. That's a very nice picture, a very sweet picture. So consider, folks, you can't think your way into a new way of acting. You can act your way into a new way of thinking and feeling. Wellness is more a state of action than it is a state of being. Having said that, let me just say, I can't thank you enough for being part of this learning community today, for everything that you offered. I'm going to show you the last slide again. It has the QR code that you can scan. My colleague, Clyde Frederick, is also going to put the link, he just did, put the link. Very glad to hear that, that the last statement is helpful, is helpful. Good. So I'm going to show you that last one. Thank you again for being here, folks. And I hope that we'll get the opportunity to be in a learning community going forward. And please make sure to celebrate Alexander Day by taking good care of yourself. Take care, everybody.
Bye.
Bye, Yvette. Thank you.
Bye-bye.
And thanks so much, Alexander.
Hey.
Take care, folks.